So what I wanted to really get to you guys today, and you should be able to see my screen now. I'm in a share screen mode, and I've pulled up a newsletter actually that we push out to you guys. We partner with a firm called HR360, and this is a service that we not only push out and use to get information to you, but I want to make sure that you know that this is also available for you to be able to push out to your clients. And some of you are taking advantage of this. But this is fantastic, and it gives you, again, it's just a value add that we offer as part of KHI. And so I'm going to have this in our background for just a second. It's an email that Nakia had sent out, and I was on her email list. Nakia manages HR360 for us, and we call it KHI HR Solutions. So again, if you're not familiar with this, visit with Nakia about it. She can get you a login so you get comfortable with it, but it's helpful with so many HR issues and questions, not just around health reform, but just running a business. This could be of value to you and your clients. And the only caveat that we have is that if we share these tools with you, obviously it needs to be shared with you and with groups that you have with KHI. So anyway, a lot of times we'll give logins as well to employer groups to have access, and that's, again, your value add that you offer them through KHI. So I'll get to that in just a second, but before I get to this email, I want to just mention a couple things around individuals and families and healthcare reform. Now, I don't know about you guys, but I was just in a social networking setting from 4 to 7 yesterday afternoon, and I was networking and talking to people, and as you know, I think it's an exciting time to be in healthcare. And I'm guessing you have committed to being in healthcare because you're on this call this morning. But I'll tell you something, everyone is going to be shopping and they're going to need help. So I can't support you guys enough. I mean, I'm going to do everything I can to make sure that we are helping you, providing you the tools and the knowledge, the training, et cetera, that you need to be able to help your clients. So as you know, individuals, families, small groups, even especially the under 50, they're all wondering what to do, and they'll all be shopping. And it all comes down to, yes, we've learned about the bronze, silver, gold, and platinum. Okay, we kind of understand actuarial values. We understand that's how the plans will differentiate themselves. We understand that all the carriers offering health insurance in this 1 to 50 space must have these plans, the newer plans, not the grandfathered, but any non-grandfathered person is going to be into one of these new plans, and any new plans are all going to be what we call metallic, right? And we also know that individuals may have up to 3 options to consider. And that's why really anybody is now a target or a prospect for you. And maybe in times past, that Farm Bureau client, right? And you wish you could, maybe you help them with some other insurance product, but they've got their health insurance because they've underwritten. Obviously, they're a prospect. Any HIP Iowa policies you've sold, they're prospects. Anybody in an old, they'll be grandfathered if they're in an old pool product, can't move, but they will be a candidate to look at the new rates. But again, it all comes back to what are the rates going to look like. And we've had all kinds of speculation about rates are going to look like, so about what they're going to look like. Oh, they're going to be high. Oh, they're going to be low for unhealthy people and high for the healthy people. And how are they going to, how are we going to get all these healthy people in? Well, since everybody's shopping, I want to be really clear about these open enrollment periods, right? So open enrollment starts October 1st through March 31st. And in that time period is where people are going to be, everyone's going to be shopping and looking. But as you know, Iowa only has about a 3% uninsured rate. So majority of our market that we're talking to are already insured. But it's this uninsured market that I want to make sure that we're real clear about. This is the ones, if they do not purchase coverage, they are uninsured today and they stay uninsured, and on March 31, they're in your office and you're telling them why they ought to buy and they don't. I want to make sure it's clear that they are locked out from buying insurance until October 15th through December 7th of 2014 for a January 1, 2015 effective date. So I just want to make sure that you know that the open enrollment period is especially for those uninsured people to be able to buy insurance. they will be assessed a penalty, as you know, and it's a lot like Part D. The penalty is different, but this whole concept of buy or pay a penalty or having an open enrollment period, a lot of this is similar to our Medicare market. So those uninsured people will only have one chance a year then to buy their insurance, and then their penalty, as you know, will be assessed on their tax return once a year at the end of the year, which, yeah, as you know, the IRS cannot come after them for that penalty. So it's pretty weak. But I think the open enrollment is the thing that's going to get people, because it's that fear of something could happen between now and when I have an accident, and I won't be having an accident on December 31st to be able to get coverage for a January 1 effective date. Well, in fact, open enrollment will be over January by December 31st. So anyway, and then also know that during the year, we think it's like, what's going to keep us all busy, right, the rest of the year, besides the other products that you might sell? But we know that there's always life events, or what we're going to call these qualifying special enrollment periods, to where somebody has a baby, we need to add the baby. Somebody adopts a child, we need to add the child. Somebody gets divorced, somebody gets married. Whatever happens in people's lives, things happen. I leave group coverage, and now I'm going out on my own, and I need to buy, and I want to buy in the exchange, or whatever the case might be. Excuse me. So just know that if you, and it sounds like you're committed to this marketplace, there is going to be so much opportunity. I really want you guys thinking in your own agencies how you might handle the traffic. Be thinking, how am I going to handle if all of a sudden, think about your community, and if you had 300 people interested. Well, I can't tell you enough, I can't stress enough how Brenda and I have said we will come to you if you need help running maybe your first seminar. I've been out with many agents now. The goal would be that let me help you get comfortable with this information and get comfortable. We've got to get out there doing seminars right now, because that's the only way you're going to be able to get to the masses, so that they know that you're the expert. Tying yourself to health insurance, especially reform right now, is what's key, because we don't have rates and we don't have plan designs, but they're coming sooner. It'll be here before you know it. Here we are mid-June already. Can you believe it? And August, you should have gotten, hopefully, the hold the date. If you didn't get it yet, you'll be getting it. But the hold the date for our training that KHI is doing in partnership with Wellmark, so that we start to learn what are their new plans, what are the new processes for getting a quote, and all those kinds of things, and enrolling people, and how do we fill out the applications, all those kinds of things. How do we help somebody find out if they qualify for a subsidy? So all that's going to be happening August, I believe it's the 22nd, 23rd. I'm going to peek here on my calendar. I'm pretty sure those are the dates. The 22nd, 23rd, and let me just buzz over here for you real quick so you can make sure you get these on your calendar. Yes, so 22nd, we're in Storm Lake. The 23rd, we are in Des Moines. And then I'm going to go into the next week. We've got on the 26th and the 27th, we're in Fort Dodge. So those are the dates for our training that we're doing with Wellmark. And just know that that Wellmark will also be holding some general sessions, but that's when finally we'll get the rates. So anyway, I just want to reiterate for you to spend some time thinking about your business and your agency and how you're going to support the volume of clients. If you're not interested and don't want to deal with it, then you probably want to find a partner, somebody who is interested and committed. And if you need help with that, you let me know. We'll try to help hook you up with somebody else who is interested in serving the market. So, I mean, I've even gone out. This is just an idea that I had for some of you. Find somebody that's most recently retired that would like to come back and help out maybe. They still have their insurance license. They'd like to help out perhaps and help you write business. We've got some offices where they've got some support staff that they've always thought about getting licensed but never really done it. I would say if you want to play in this space, now's the time to get that administrative person licensed so they can be of assistance to you. And as you know, ironically, this same open enrollment period is happening during Medicare. So if you're playing in that senior space as well, it's like all this is happening at once. So it may be some temporary support you need. And again, if you want to talk offline or strategize offline about some things that I know Brenda and I have kicked around and talked about, how we can, just ideas to help you guys and your businesses handle this influx, okay? Now I want to talk about small groups. And I want to talk about several things. If you do or don't call on small groups at this point, I guess if you're committed to this market, you're going to want to. So I'm going to talk to you as if you all are working with small groups or you have small group contacts in your communities. You know small business owners. And you guys, I'm not even talking about those that are over 50. You're going to have some of those as well. I'm talking anybody that has, excuse me, that has a small business. You want to make sure that if you're talking to them, make sure that they know that there's some key things as an employer, regardless of their size, that they want to be able to, that they should know. And you can always ask them, if you're not their broker or agent today, ask them if they've talked to their agents about healthcare reform and some of the things that are critical, ongoing, that as an employer you need to provide. Hopefully their eyes will get real big and they'll be interested and they'll learn that you're here to offer value and education, and then they'll come around and want to buy with you and work with you. So make sure they know about the 90-day new hire waiting period. That's the maximum, and it's 90 days from the date of hire. So they have to calculate, okay, what would that really mean? It cannot exceed 90 days from the date of hire. So really that new hire waiting period looks something like it's 60 days after the first of the month following employment, right? That's when their benefits are going to start. Because if I start on the 2nd of the month, then I can't exceed 90 days, so I'm going to have to do the first of the month, 60 days following the first of the month following my hire date, right? So anyway, that has to be changed, and that has to be changed prior to January 1st so that they're in compliance. The other thing they have to do, and I'm going to draw your attention now to the email that I've pulled up. We sent this email out. If you didn't get it, we can get you a copy of it, and it looks like I've got a little star here. Let me just switch over, see if I can get back. A little star is stuck. Are you guys seeing my star? Yeah, I think you are. I saw this happen the other day. Hopefully we can kind of work around the little star here. Let's get our screen back. Sorry. Little technical difficulty here. Holy cow. All right, let me go back to Nakia's email here. Okay, so I'll scroll down a little ways, and in Nakia's email here, I want you to notice that it was talking about COBRA election notice, but it also snuck in here, what I call snuck in here, the insurance exchange notices. And so there's an email or a part in here that talks about employers and group health plans administrators now have new model notices that were released by the Department of Labor. Now it's saying that the new model notices need to go out to all employees, and it's written, and obviously they need to get it there no later than October 1st. So we've got what needs to be given to the employers, and if you recall, this was like supposed to be out by April 1st, and it was not done, so they pushed the date out. So they've said now by October 1st, this model language needs to be delivered to each employee. Well, what does that look like? And it's interesting here because in this email, again, this was from KHI. This is our email that comes from KHI HR Solutions. And it says there's two different notices, one for employers who offer a health plan to some or all employees, and another model notice for employers who do not offer a health plan. So when I clicked into one of these, and that's probably where my system was going bananas, because I clicked into one, and this was the 90-day waiting period, and I'm going to close that. Let me go back here to my email. And when I clicked on the model notice for employers who offer a health plan, it's going to take me to a government website. It's the Department of Labor website. We'll see if I can get on here. Again, I apologize for that little, looks like a little sunny figure there. I can't get it off my screen. But here's the notice. Now, to make it easier for you guys, I'm going to, as soon as we get done on the call, I'm going to go visit with Nakia, and I'm going to have a special KHI news release pushed out, and it's going to say, here are the two types of documents, and we'll have those as attachments, so you don't need to go through what I am and trying to go to some government website to pull this. But I found this interesting. This is the model language right here. And so it says right there that this is, the health law takes effect 2014, a new way to buy health insurance. And here's some basic information about the new marketplace and employment-based health coverage covered by your employer. So here's, and so this can just be copied and pasted right into an email. You'll notice here, notice it says if you purchase a health plan through the marketplace, instead of accepting health coverage offered by your employer, then you may lose the employer contribution, if any, to the employer offered coverage. Also, this employer contribution, as well as your employee contribution to employer offered coverage, is often excluded from income for federal and state income tax purposes. Your payments for coverage through the marketplace are made on an after-tax basis. Now, what they're saying here, and remember, they're saying too that if your employer offers coverage and you buy through the exchange, not only will you not get that employer contribution, but it doesn't say it in here, but they may or may not be eligible for that subsidy inside the marketplace. If you look up above, it's saying here is, does your employer have to offer coverage? So it's got all the language in here that the government is recommending that employers give to their employees, and that's exactly what it's talking about there in that paragraph just above. So it's saying if you have an offer of health coverage from your employer, it has to meet certain standards, then you'll not be eligible for a tax credit through the marketplace. So here's my point. I'm just going to kind of scroll down again here, but here's my point, you guys, in that every person is going to have basically 2 or 3 options for shopping for coverage, and this is why they're going to need your help. So not only can they look at their employer, and if they're a spouse of an employee, on an employer plan, then they can look at that option if the employer is offering that, but they can look in the exchange and look outside the exchange. So here's the model language, and then I found this really interesting. So if you go down to the next page, here's Part B, information about health coverage offered by your employer. Now check this out. So this starts to give us an inkling or a clue into what kinds of information they're going to be looking for in terms of applying for coverage in the marketplace. So this says if you decide to complete an application for coverage in the marketplace, you'll be asked to provide this information. And this information is numbered to correspond to the marketplace application. So I find this very interesting. So they're providing the information from the employer address, and they're going to check. And why? Because they want to make sure that somebody who has offered group coverage is not going to be able to get a subsidy inside the exchange. They can buy in the exchange, but they cannot get a subsidy. So you'll notice here it's who can we contact about employee health coverage at this job. And here are some basic information about health coverage offered by your employer. Is it offered to all or some? With respect to dependents, do we offer coverage? We do offer coverage too, and is it eligible dependents? Okay, and you guys know this too, right? They do not have to offer spousal coverage. Employer groups do not have to offer coverage to a spouse. Of course, they don't have to pay for it, but they don't even have to offer coverage for a spouse. So I won't go through this whole thing, but I wanted you to see that, and I'm going to be sending this out. So you don't need to email me to have me send this to you. I think we sent out our email, but I'd like to make it even more prominent so that you guys know exactly what the letters are. And then again, what value you can show to employer groups and say, hey, here it is. Here are the 2 sample language, letters for the language, whether you offer coverage or decide not to offer coverage. And and then I think that was it. I think it ends up just a couple other questions here about the employee currently eligible for coverage, etc. So interesting stuff here on this. So I'll get that to you guys. And so as I kind of go down through, and then I'll definitely open it up so we can have some good dialogue and questions here. So the 90-day new hire waiting period. This is kind of the list of things to make sure you're touching base with on some of these employer groups. About the model language, of course, with access to the marketplace. Let's talk again about hours. Make sure that that employer knows that 30 hours a week or more is considered full-time. Not to be confused with, do I have to offer coverage or not offer coverage to part-timers, right? You do not have to offer health coverage to anybody as an employer working 29 hours a week or less. I have to offer, if I'm going to offer coverage, to all employees working 30 hours or more, okay? So we know that's why right now it's important that you sit down with that employer group. You get the person that's responsible for scheduling their employees to sit down and look at hours and how they schedule. We never really had to care about this before. And we never had these. I don't remember ever listening to you guys or talking to you guys or being with you on an appointment where we talked about hours of employees, other than if they're full-time, then they're offered benefits. So now we have to get into, is it 30 hours or more? Or maybe if somebody's at 30 or 32 today, remember, if I'm offering group coverage, they can't go into the exchange and get a subsidy. So maybe would I do an employee a service by dropping them down to 29 hours a week, and then they can go into the exchange and get their subsidy. So see, the questions that you want to have, and this is, I raise these sometimes in our seminars to get small groups thinking, but that's not a place where they all want to now start airing how they schedule their hours, because usually they're in there with a bunch of other companies. But that's when you have a one-on-one meeting with them to really try to uncover how do you schedule, how do you count hours. Many of you have emailed me and said, I've got clients that don't even track hours. They pay strictly on commission. And my question back to them is that person working more than 30 hours a week, even though you're paying them commission? And they say, well, I don't know, we don't track. The employer has to start tracking. My guess is that many of those employees that are on commission only are working more than 30 hours. They're doing this job full time. So somehow you need to be able to say, yes or no, they're full time, or they're less than 30 hours a week, or they're 30 or more. Then you have to offer them coverage, because I've had people going, yeah, but I don't offer them coverage today because they're strictly paid on commission, on the products they sell. Well, in this new world, and that's why you're seeing a lot of companies having these conversations, playing with hours and trying to figure out how they're going to have to, how they can afford to offer health insurance. And again, you guys, these conversations, all the stuff we're having, it doesn't matter how big or how small. I'm talking about any employer offering coverage. 50 and above, less than 50, it doesn't really matter. It's all still about 30 or more, you must offer it. If you're offering it to anybody, you must offer it. And then the 29 or less, you don't have to offer it. But again, that 29 hours or less, those part-time people are calculated into the calculation that uses full-time equivalents to determine if somebody's 50 or more and must offer coverage or pay a penalty. Okay? And remember, really quickly, just off the top of your head, you should know this formula, because it's not hard, but you need to sit down with them and have them help calculate all their people and all their hours. You take their full-time, they know are 30 or more, put those in a bucket. Okay, there's 40 of those. Okay, how many part-timers? Well, I got 20 part-timers. Well, what are their hours? Well, they're all over the place. Well, let's add them up. You add up all those part-time hours for a month and divide by 120, and you'll come out with your full-time equivalents. Add that to your number of full-time people working 30 or more. That's when you know, do you have to offer coverage or not? How close are you teetering? I know I met with an agent with a group the other day, and this client was sitting at about 40. And says, Lynn, we're at 40 full-time equivalents. And I said, well, okay, let's go back to, do you really want to offer health insurance or not? You don't have to today. If you stay at 40, come January 1, you won't have to. But really, the sit-down conversation you guys need to have with these groups are going to be around hours of your people. Do you plan on growing? If you grow, where will you grow? Will you grow via part-time help? Will you grow via buying another business with more employees? Will you grow adding more employees? Again, I'm going back to what I said already, but we've not had these kinds of conversations before. But now is the time that we demonstrate our value, have these kinds of conversations with them to make sure they stay in compliance, but also to make sure that financially they're working within whatever budget they have to work within. I said this at my last seminar this morning, but I'm going to repeat it. We need to be talking, maybe the idea is that employers, here's the question, how important are your health benefits to attracting and retaining top talent? Now, you guys, you got to memorize that, right? If you don't have that off the tip of your tongue, you got to know that one. How important are the health benefits? How important is that, right? Is that part of your benefit package, the health benefits in particular, to attracting and retaining top talent? How important is that in your business? Because if their answer is it is not important, okay, end of discussion. He's going to be sending everybody to the exchange, and your next question to them is, can I sit down and meet with everybody? Will you give me time here at your office to allow me to meet with them, and they can rotate in one-on-one, and I'll visit with all of them about what their options are come October 1st, right? So I can actually quote rates. Okay, if he or she says absolutely, it is imperative, because the next question has to do with turnover. you want to keep people. What if you tell people, go away and go get your own health insurance? Really, especially if that's how you said it, I don't know how valuable those employees feel, right? And especially now, if I can go get my own health insurance and I kind of stay here because of the health insurance, and if you're not helping me pay for it, there's another competitor down the road I might go consider. So these are the conversations you want to have. So a thought that I want to plant with you guys is, think about this. Is somebody might say, you know what, I'm going to get you to the exchange because you will qualify based on what that employer pays his people, and you need to be asking them that too. How much do you pay your people? Give me the dollar amount of your lowest paid person. So that's why this meeting is sometimes the owner of the business, but sometimes it's even their accounting person or an HR person or a scheduler or somebody that can answer some of these questions. Now, we've got a tool that can help you. You guys, when the companies start getting to be 40 and 50 and more employees, that's when we have a tool, a modeling tool that can help you guys. It's, we purchased it through National Association of Health Underwriters. It's an ACA decision tool, and it'll help you guys help them. And I can get you, email me on that if you're interested in getting a copy of that. It's more like a survey, if you will, that I can get to you. You can get it, sit down and go through it with your client. Get it back to us. We'll plug in the information, and we'll send you the modeling information. It's really kind of cool. And I have to enter it for you right now because it's only we only bought one license for right now, so we're managing it here for you. But certainly you guys have access to it, but it's like $500. So anyway, until you're ready to make that kind of an investment, we're here to help you with that. But some employees, or excuse me, employers are going to need that modeling to help them make a decision going forward, and there's your value add. I think that, again, can solidify you in with that group case, especially if whoever they're working with is not coming to them, giving them some of these tips, offering this kind of support to be able to help them make a decision about should I or shouldn't I offer benefits. So whether they do or they don't offer benefits, let's assume in this case, for this scenario, that an employer has said, how about, because I only pay my people on average about $30,000 a year, let's say $35,000. You guys, they're still eligible for a subsidy, probably up to about $48,000 a year. If they're paying all their people more than $48,000, $50,000 a year, then we don't need to waste our time on the subsidies. It doesn't matter. I mean, those people will not get a subsidy. Therefore, they'll either probably stay with employer coverage or they'll just go buy on the open market or whatever on their own, okay? So take the subsidy out of the picture. But if I've got people that I'm paying more like $30,000, $35,000 a year, think about this. Would that employer be doing them a service by allowing them to go into the exchange, get a subsidy, and then what the employer could do is to still, in essence, keep their arms around them. What that employer could then do is offer short-term disability, long-term disability. These are all guaranteed issue products. How about life insurance? How about even dental or vision? See, offer some of these ancillary products that they'll have a harder time getting a hold of. In fact, I don't know of a short-term disability product that you can get on the individual market, right? So now the employer can come through and say, hey, I'm not going to offer health insurance. I'm going to ask you guys to do that on your own, file for the subsidy, but I'm going to come through and offer you this, that you either can't get or it's more difficult to get in the open market. And the short-term and long-term disability, I think, and of course life insurance, when it's all guaranteed issue, it just, how can you fail, right, with something like that? So anyway, so I just wanted to, I'm going to go back here to my email that I was talking about. So there's the model notice. Okay, so as I was talking a little bit more about then the whole, am I going to offer it or not, going into the exchange, do I cut my people's hours back? I mean, all this stuff you need to talk about. And then how about fees? Okay, so this is a really big one. And this is, as you know, in one of our last conference calls, we talked all about those ACA fees. And there's about 5 of them. And they're not applicable to everybody, but almost everybody. If you just kind of go down through and look and see, again, if you need that one, I know that we've got that. I think we pushed that out. And if not, I've got it for you guys. If you want to send any one of my teammates an email, they can get you the fee fact sheet that we just used. We got one from Blue Cross, and I also have one from Coventry that they just put in there what the different fees are. So I've got a couple of those. But the fees, I want to make sure we're clear on this too. So this has to play into this conversation you're having with that employer. And that is that for every person on there, and I love it, I'm going to claim this from Brenda, calls it every belly button. So every belly button that's on the policy, that means spouses and children, will incur these additional fees that are being passed down by the carrier. We estimate approximately $15 to $16 per belly button per month. So, and I'll tell you something, that's when an employer says, wait a minute, okay, I don't mind maybe paying the fee, an extra $15 a month for my employee, but I think I want to pass that fee on to the employee's spouse or children if I'm offering coverage to the spouse, and then of course I have to offer dependent coverage as an employer if I'm going to offer coverage. So think of the extra belly buttons that are on my policy that I'm going to get the bill for, and am I going to pass that through? And the answer tends to be yes, I'm going to pass that through. That's part of their expense to buy through me, because guess what? If a dependent or a spouse chose to buy on the exchange or in the open market, they're still going to get a fee. So they're going to pay for it one way or another. Now the interesting question that we had, and Brenda and I were just talking about this yesterday, that if they pass that fee on, can that fee be payroll deducted, and can it be deducted pre-tax, like the health benefits? So I've asked Jason Dynison, our CPA guy that we've partnered with to help me with some of these questions, and he's doing some research on that for me to see if that can be a pre-tax deduct, or do we now have to break out those taxes and make them after tax? So the employee could still pick it up, right? We could still do the payroll deduct, but it makes a difference now if it's pre-tax or post-tax. And then the other question that came up that we're pursuing an answer to that we don't have yet, and that is, can the employer, now that it's a guaranteed issue, can a small business employer just tell his employees, go get it through the exchange and I'll pay for part of it? Okay, so we need to think through how does that work. And so we don't have an answer on that yet, but we've teed that up as well. So we'll get you an answer back on those two items about the taxability of these fees, and what about the employer just saying, just go, and can I still pay for it though? Pay half, pay 3/4, pay whatever. Can I still do that and tell them to go into the exchange? Now I have a funny feeling there's going to be some limits on that, because if you get this, in essence, the employer is, if they're paying, they're kind of offering coverage, right? And so it's like, okay, wait a minute, but yet then if they're really not offering coverage, but now they can go into the exchange and get their subsidy, I think the government's going to see that as that's not right. So interesting. So still to come on that whole idea of, can the employer tell them to go to the exchange and then I can somehow pay for some of that through employee payroll deduct, and then is it pre-tax, post-tax again? You get into all of that. So more to come on that. And the spousal, and then I'll open up here. I just have one other point I want to make, and that's on the spousal coverage. So make sure that your employer group knows that they do not have to offer spousal coverage. And in some cases, it may be helpful that the spouse is not offered coverage. Therefore, and I ran through this again earlier this morning, but therefore if a spouse of the employee is a non-working, maybe stay-at-home parent, and they need to get health insurance for themselves, let's say we've got employee and kids covered on the policy at work, as long as spousal coverage is not offered, that spouse can go into the exchange, and based on household income, if they're less than 400% of the federal poverty level, which for a family of 4 runs about $98,000, is that right? Excuse me, $92,000 a year, then that family might be able to get some assistance helping to pay for the health insurance of that spouse. So see, the employer would almost do a disservice to that spouse by offering coverage if it's not really great and very affordable, right? They might do more harm because that spouse wouldn't be able to get a subsidy then through the exchange. So all kinds of things to really get down and deep about each employee within that company to figure out what the best thing is. And so much of this is in our under 50 market space, because the people that are over 50 know they have to offer it. They still might decide, am I going to offer it to spouses or not? But I'm telling you, this, you know, and one more thing I just want to add. Remember, those that are 51 plus, in that, what I'll call, it's still considered small group, but really until 2016, 51 to 100 is not part of the exchange, that marketplace. They can't go buy in there as a group, right? That 51 plus, though, can still ask health questions. Rating is still rated based on experience, and that it's not rated like it is in the 1 to 50 space with age, where do you live, and do you use tobacco. So, you know, pretty much business as usual for the next 2 years in the 51 to 100 space. In the 101 plus space, we know 101 plus, we know that to be the case. It's still business pretty much as usual, although there are some essential benefits that they need to abide by. All plans need to abide by. But certain things, I mean, again, it's only restricted, those metallic plans, just restricted to the 1 to 50 marketplace. Okay? Okay, so let me, I know I didn't have a whole lot on the screen to show you here today, but let me go ahead and see if there's any questions. If somebody can raise a hand, and I can see if, I can see if anybody's got any questions. See if I've got any chat questions here if you're typing in a question. And I don't see anything yet. I'll give you just a second if you want to type in a question or you want to raise a hand. Okay, I'm not seeing anything. Let me see if anybody else has a hand raised. Okay, I'm not seeing anything else here. Let's see. I think I saw an email pop in while I was talking to send you the fees, and we can certainly take care of that for you. And I can't reiterate enough. And here's kind of the line of attack. I know some of the agents have already contacted each carrier that's specific, especially on a large group case. These are, I know I've got several of you on the phone that have some large group cases. And obviously they are looking at, they have to offer coverage, but how can they offer coverage that, you know, would stay within a budget? And you know, we're looking at, until we can see, again, it goes back to, we haven't seen any rates, we haven't seen any plan designs, but we do know that the bronze plan is the lowest actuarial value plan in the 1 to 50 space. But it's interesting because, remember, these large groups, they must offer coverage that's as good or better than the bronze plan. They don't have to call it bronze. They don't even have to follow the metallic plans. But they've got some of their own calculators that they're using. Large employer groups then can type in the benefits that they're offering and then see what that comes out to in terms of actuarial value. If it comes out to be a 50% actuarial value plan they're offering, and that's what they're going to offer, then it's not considered quality, which that's okay. They're at least offering coverage. But remember, when I go back to our basic slide and our basic presentation we've talked about so long ago, if they don't offer quality coverage or affordable, making sure that nobody's paying any more than 9.5% for at least one of their plans. So that's why I offer a 60% actuarial value plan and pay at least 9.5%. You know, don't require any employee. Take your lowest paid employee and make sure that you're not charging anybody more than 9.5% of that lowest paid employee's salary, and then you know they're covered. But if they don't meet either affordability or quality, then, and if one of their people goes into the exchange, then this other penalty can kick in. So even though they're offering coverage, they could get hit if their people leave. So even on those large group plans, and let us know if you, I don't have one off the top of my head here of a calculator, but we've got, I'm sure we've got access to one if somebody needs to plug in all the caveats of the plan that they have in their, when they're in that 51 plus space, and see that they're offering quality coverage. Now mostly, as you know, from 50 to 100, it's going to be pretty standard plans, but you can get, whether it's self-funded cases or whether it's the fully insured that has a real creative plan that they've designed and put together, they need to verify that it meets that 60% actuarial value or better to be considered quality plan. Okay. So, okay, let me check here and just see again if I've got any questions? Doesn't look like it. Don't see any hands up. I don't see any chats. Okay. Well, that was about what I had to talk to you about today. And I want you to know that that we're doing. I'm traveling around doing, and for anybody that's in the Harlan or Council Bluffs area, I've been invited to join the Iowa Western Community College and do an educational seminar. And I invite any agents that are in the Harlan or Council Bluffs area on August 1st and August 6th. I'm doing a seminar. It's in the evening too, so it's open to the public, and it's an educational seminar. And if an agent of mine shows up there, I'm going to introduce them, and I'm going to encourage people to visit with them afterwards. So just know that I'm out there trying to stir it up for you, and I'd be interested in coming to your area and stirring it up with you. So if you haven't gotten a hold of me yet to do a seminar in your area and you're interested, please shoot me an email. My schedule is filling up rapidly, and as I told you, training with Wellmark, August 22nd, 23rd, 26th, 27th. We'll be on the road doing that. We know we've got a great healthcare symposium going on in Des Moines. I'm a part of Health Underwriters, and that's August 7th and 8th down at Prairie Meadows. It's going to be an amazing 2 days. And if you're a NAHU member, you're going to get some special things, VIP stuff going on down there for you. If you're not a NAHU member yet and you'd like to be, please let me know. I'd like to talk to you about it and why I think you ought to be, and how we can support you in that through KHI. We can get you a discount on your annual membership and take care of the billing for you. So yeah, just give a holler. So lots coming up. And then Co-Opportunity Health, we did our first round of folks that were interested in contracting with us for Co-Opportunity Health. So thanks for all your help and getting that to Nicole and getting that done. We're going to be doing some, the Co-Opportunity Health training won't happen until September. It'll be classroom, probably 4 hours. And they are filing for some continuing ed for those that need it. And I'm sure Wellmark is filing for continuing ed as well. So good stuff coming up, you guys, but it's going to be here before we know it, right on top of us. So, hey, I'll let you go with that. You guys have a wonderful day and a wonderful weekend. Just fire me off some emails if there was a question, and I didn't see any hands raised, and I didn't see any questions. So it looks like, yep, I'm getting some emails now in from some folks. So just go ahead and shoot me some emails, and I'll get back to you. If I don't get to you today, I'll work on it over the weekend and try to get a quick answer back to you, okay? All right, well, you guys take good care and have a great weekend, and we'll be in touch. Bye-bye.